smaller patient panel sizes, they're going to spend more time with the patients that they have to influence their health, to give them good health outcomes. Again, back to more happy and healthy days and less hospital sick days. Imagine if you could see your doctor and the doctor says, I have a lot of time to spend with you. My doctor doesn't even tell me that. And I still see my doctor frequently. And it's just something that is unheard of. And prior to coming here, something that I had never heard of. And now I live it. I practice it. And my patients love it. They love that they can see me frequently and I know everything about them. And it's not like if something does, God forbid, happen to them, I can make sure that they get the best care wherever they're at.
Yes, and that is so important, especially because some of them might not feel comfortable at the very beginning to share everything with you, but at this, as they get to know you, they get to know you, trust you, and feel good, and then they share more. But if they feel rushed, they get nervous, and then they forget things, and they don't tell you perhaps what they got there for. And that has been one of the
Mm-hmm.
biggest complaints that I had with some of my patients or my clients is that they say, well, he only saw me for 5 minutes and then told me that that was because of arthritis, because I'm old, but never really got to understand why, the source of the pain, right? The
Right.
reason behind it. So that is amazing. Thank you, Dr. Jawala, for all you do.
Absolutely.
Now, the locations. Let's talk a little bit. I know we are talking about, let's concentrate on Tampa right now because I know you have locations in Miami, but because Cafecito with Rosie on air is here located in Tampa, tell me a little bit. You guys have offices right now in Hillsborough County, Pinellas County, and I do believe you have in Pasco County too, right?
Yes, we do. So we are so our locations are actually, I guess it would be also Manatee. So it'd be Bradenton, St. Pete, Clearwater, Largo, East Tampa, and North Tampa. And we actually also have two centers in Lakeland.
Wow, yes. Oh, I didn't realize. I know that I'm more familiar with the Tampa Bay area, so I kind of like stay concentrated. But now
Hmm.
that you mentioned, I remember that you guys are in Lakeland too. And the whole idea, your transportation, it's about the radius of people that you are looking that you will be able to help in the transportation is a 10-mile radius, I believe. So that's where you kind of go and look at the opportunities perhaps to have a location in that area that service that 10-mile radius. How do they select the location where you guys going to be servicing your community?
So what we do is we actually look and see where are the communities that are really in need. Every time we look at a community in need, they usually don't have a grocery store or a good one nearby. Our communities do not have many doctors' offices. A lot of our patients are underserved. They have lack of transportation, which is something that's very common, which is why we provide it for them at no cost. So when we look at building a center or moving out to a different area, we always look and say, are we serving a community that's in need? Because that's our purpose, our vision, our mission. Why are we here? We're here to help people who need help. We want to make sure that we do this purposefully, that we are there to help the people that do not regularly get to see a doctor and want to see a doctor. And one thing I forgot to mention to you earlier, Rosie, on top of everything that I'm talking about, on top of the time, we give our cell phone numbers to our patients. That's something that people, and I'll say it again, we give our cell phone numbers to our patients. They can call us, they can text us. When you only have 400 patients and you have a close relationship with your patient, you're going to want, as a provider, you're going to say, I want them to call me first. I want them to text me and tell me that they need something or they didn't get the medication that was sent to the pharmacy, or they're out of their medications. We want to know. We want to be the ones to know first. And the patients, they love it. They look and they say, you're giving me your cell phone number? And we always say, well, if I'm going to treat you like family, I would give my own mom my cell phone number. Why wouldn't I give you my cell phone number? So at the communities that we serve, we always try to go with the underserved communities, and we do everything for them. We give them the cell phone numbers. We do food drives. We make sure they have transportation, and we really try to do everything that we can to make sure that they feel that they're loved.
That is so amazing. And I know for Thanksgiving, Francis, a really good friend of mine and the executive director of the Tampa location was getting hams and for Thanksgiving for your
Hmm.
patients, and they did a drive of a food drive and giving back to the community because perhaps I believe you also have like a monthly supply of groceries, if I'm not mistaken, because some of
Hmm.
these communities might not have that. So tell me a little bit about that.
Yeah, that's what we call food insecurity. When patients have poor access to food because of their income or the zip code that they live in, we find that to be something that we can battle. When patients call and say, we do these love calls and they say, I haven't had anything healthy to eat in a long time, we ask them, well, why is that? It's not because they want to eat unhealthy. It's because they are a victim of the circumstances. It's the area that they live in. Maybe they don't have transportation. They just can't get to a grocery store. So what we do is we have partnered with local food banks, Feeding Tampa Bay. We get donations. We get fresh fruit. We get fresh vegetables, and we will hand it out to them. We make little bags, and they're basically something that when the patient comes to their office appointment, if they're saying that they're hungry, we make sure we give them something because we don't want patients to, after all the time they spend with us, to go home and to only find out that they have um, decreased access to healthy food options. That's going to affect their health. That's going to affect their outcomes. And if we're going to treat them like family, we need to make sure that they're fed well, they're fed healthy, make sure they have good access on top of everything else that we're doing. We again, it's that family feel. Treat them how you would treat your own family, and you'll have the best outcomes for your patients. That's what we always say.
Well, Dr. Jawala, I had such a wonderful time getting to know you and getting to know dedicated first, dedicated more, um, and also to thank you for the opportunity to support this dream and to make to make our community better. So I really do appreciate your coming to us today. Thank you so much. And my dear friends, I'm just going to share this with you as dedicated senior medical center idea was to change their communities, giving back to the communities. I encourage you, once you find your purpose and you turn it into a vocation, you find your business, the way that you are able to get to know your community or for your community to know you is by changing your environment, getting involved in nonprofit organizations, getting involved in volunteering for these food drives that change your community. At the very beginning, people are not going to be really looking for your services, but the more you give back, the less they're going to see you as a salesperson. If not, they will see you as somebody that truly cares. And you know how they say, people do not remember what you do, but they will always remember how you make them feel. So be true to yourself, care for others genuinely, and let's change our community. Gracias one more time for joining me today, and thank you for listening to Cafecito with Rosie on air. Ciao.